Hello, everyone. Today, for our Provider Spotlight initiative, we have Laura Brown. Laura is the owner of Sapphire Women's Health in Westford, Mass. She's a women's health nurse practitioner and is a Menopause Society certified practitioner as well as a wellness coach. And we want to bring her on today. So we've had a lot of women that are pre, peri, postmenopausal that have issues, and also people that struggle with weight loss. And Laura has a great service that we wanted to highlight because she's a little different than others. And I'm going to let her kind of talk about that a little bit. So, Laura, tell us all about who you help, why you help them, what got you into it. And
Yeah, so I opened Sapphire after I got really mad about how women were being treated in menopause and perimenopause by their traditional healthcare. I worked in internal medicine for about 5 years and then in OBGYN for 3 years after that, and became a menopause specialist about 4 years ago, and have absolutely fallen in love with treating women in this time period. It's a time of a lot of change for a lot of women, and there's not a lot of answers out in the mainstream. So, what I'm seeing is a ton of women educating themselves. And while there's a lot of good info out there, there's also some really incorrect information. So, I like being able to educate women on what's going on and then being able to treat them in perimenopause, menopause. I also do some women's sexual health concerns, and then also some medically supervised weight loss.
so if someone comes to see you versus the other person down the street, what is the big
Mhm.
difference they're going to get of seeing you?
Sure. So I am a cash-based practice, which means that because I don't accept insurance, I don't have to go by insurance rules. So I specifically chose to do that because I wanted more time with my patients. I don't get enough time with 20 minutes to have a robust conversation to really understand all of your symptoms. There's actually 34 symptoms of menopause. And so just asking about those is going to take me 34 minutes. Let alone getting your health history, your concerns, your perspective, and then going through your treatment options. So I was very intentional about choosing to spend an hour with my new patients. And so on the menopause, on perimenopause side, that's how I'm different. And then when it comes to the medically supervised weight loss, I am one of these people who is prescribing the GLP-1s, semaglutide, Ozempic, what have you. But I also wanted to do that in a different way that allows my patients space to be human, but also to decide that they want to make some really big changes in their lives, and to do it in a way that is safe and effective, and so that they don't have to be on these medications for the long term, but can just sort of use it as a way to jumpstart a journey in health and not just weight loss.
Yeah, and so what tools? Because you're essentially what you told me. So Laura was also on our podcast earlier. Um, so if you're listening to this, you would be interested in hearing all about our Ozempic podcast we did. But what things are you going through with people when it comes to putting them on things like Ozempic?
Yeah, so we always start with baseline labs to make sure that you look like a safe candidate. And then we talk about your goals, and sort of prior attempts at weight loss. What are some barriers? Those sorts of things. And then my programs include the price of the medications, because I get those compounded, use of my in-body composition scanner so we can really track your progress and not just go by a number on a scale, but see what is fat, what is skeletal muscle mass, what is water, and where we can really target some interventions. And then you're also entitled to up to weekly half-hour coaching sessions with me, and that's where we really love to sort of delve into the thought work of this. So a lot of people will talk about their experience with these medications as quieting the food noise, and I use that as an opportunity for us to dig in and start establishing other habits. So making sure that you're, getting in the healthful foods, and making sure that you're optimizing your sleep and your stress, and certainly starting or increasing your fitness regimen, those sorts of things. But in the process, really teaching you how to coach yourself so that when eventually you do come off of these medications, A, all you have to contend with is the food noise because you already have these great habits in place. But B, you now have the tools to address these thoughts head on and choose differently.
Mm-hmm. And we kind of discussed it on the podcast a little bit too, but you don't think people should really be on these long term. You think there's other solutions that we can use the drug as a um, catalyst to progress and success, but it's not the
Hmm.
end all be all. That we're seeing too many people just band-aid their issues with the drug to silence the noise, but they're not changing their actual behaviors of eating, lifestyle, etc.
Right. Hmm.
So
Exactly.
I I really like and appreciate that that's kind of what you're doing, because that's how I think it should be done, and not just, oh, big pharma says we need to go on this for life because you're overweight and you
Right.
haven't been given the tools yet and you haven't seen progress.
Hmm.
So let's put it down. And then for the women that are in search of HRT and things, is there anything different you do with them as well? Does it include the same type of like coaching regiment that the medical weight loss gets?
It can. I utilize a lot of those tools in my menopause appointments, but that's not as much of a program. So I do offer coaching independent, if that's something that you're also interested in, and currently running a perimenopause group coaching cohort as well. So I hope to be able to continue doing that in the future as well, because I do believe women absolutely thrive in community, and when we are going through these massive changes, I think it's all the more important to have that support network. But in terms of HRT, there's very few women who have contraindications to being on systemic hormones, and almost no woman has contraindication to being on local vaginal hormones, which can make a huge difference in quality of life for a lot of reasons. But especially, actually, it's vaginal estrogen is approved and endorsed by the American Urological Association for the prevention of chronic UTIs, which can kill people. And so I think there's just a lot of, I think in both of these arenas, there's a lot of education and re-education that I get to do. And in my earlier life, I believed I wanted to be a teacher, so I think this is tapping into that sense of things for me. But I think it when you have more knowledge, you are more empowered. You can find, the right things for your life that fit into your lifestyle that make you want to make changes for the better. And I think I'm seeing that in great numbers right now with people who are in perimenopause and early menopause who are like, we missed out and we're not going to go down the way our mothers and grandmothers did. So how do we get to age the same way that men do? Honestly, where we're spending more of our life in ill health. I think a lot of us have seen that happen and we're just not interested in it. So these are ways, jumping off points, if we have the knowledge and the education, that we get to make other choices that weren't available to our mothers and grandmothers because no one told them.
Mm-hmm. Yeah. And what is this women's group you do? Because I'd be curious to send some of my women over to that too. The cohort
Yeah,
you have.
so
What's that
we
all
meet
about?
once a week virtually, and we do coach. We learn some coaching skills together and kind of take it from a lens of specifically from perimenopause. So I'll do some one-on-one coaching with the participants, and in the process, hope that they're learning how to coach themselves and to coach each other as well. But also just a little bit of support and talking about what's going on in our lives, and then sprinkling in some conversations about HRT, about effective weight loss strategies or nutrition or fitness, or we do a lot of sort of coping mechanisms and mindfulness and different ways to approach stress management, because many of us in perimenopause have little kids at home. We're working on our careers. We might also be caretaking for older relatives. We've got a lot of stressors, and so how do we manage that so that things don't get away from us health wise or mental health wise either.
Mm-hmm. And for the person that's going to have success with you, what is that perfect patient? Or, is there a couple different subtypes of the perfect patient that you get?
That's a really good question. I think for my weight loss patients, the ideal people are not the ones who want a quick fix. They're coming to me with the understanding that they want better for themselves and better for their families. And they understand they need to make changes. They're just not totally sure what those changes are. And so I think, many women come to me for a variety of reasons. Some of them are, body image issues. Some of them are health issues. A lot of it, I think, is yeah, just sort of this idea that they don't like the trajectory that they're on and they want to find a way that is sustainable to make changes that serves who they want to be in the long run. So I think that's sort of my weight loss patients, and then my menopause patients. I just get so much joy out of teaching them, about their bodies and from for many of them who have already, passed the menopause transition, who are really uncomfortable, and their quality of life has been significantly impacted by their symptoms. And yeah, I just talked to a patient today who I started on estrogen and progesterone therapy, and she's a few years into menopause, and she called to ask me for a refill, and we were chatting a little bit, and she just said, "This has been a game changer. I'm sleeping so much better. I got such a solid night of sleep, and I am not annoyed by my husband's breathing anymore." And just
Lucky him.
it's really yeah, I think impacting people in ways they don't even anticipate. And again, like I was saying, there are 34 symptoms of menopause, and not you don't know all of them. People know about hot flashes because other people can see that happening. We know about irritability and mood swings, but very few people know that joint pain is one of them, and frozen shoulder. Very few people know that heart palpitations or dry eyes or itchy ears. That's the one that blows people away. But painful sex, decreased libido. Like there are so many different symptoms that you might not even realize are associated with menopause. And it cracks me up when people come up to me at various speaking events I've been at, and they're like, I did pretty well in menopause. And then we get to talking, and I'm like, oh, but this, oh, and also that, and oh, that might have been perimenopause too. So I think there's just a lot of areas for potential intervention, and then also talking to them about how we can use these things as preventative, right? So estrogen is protective of your heart and bones and brain and probably your breast too. So really, again, it's just that education of like, here's what we've been missing out on for some really silly old data points that are incorrect. And the answer for me is more often yes than no, versus a lot of other clinicians. And sometimes it's the PCP you've been seeing since you were 18. Sometimes it's the OBGYN who delivered your babies, who are just behind. They're not up to date on the current data. And so they're telling women that this is just part of aging, that they just don't like their husbands. Maybe they just need a new husband, or have a glass of wine and then sex won't hurt. And those are unacceptable answers to me. And they have become really unacceptable answers to a lot of women. And so I like to have a time to really listen to my patients and gather what their experience has been, and then hopefully, find ways to intervene and make life what they want it to be. I
Absolutely.
like to think of it, instead of a midlife crisis, a midlife renaissance. That's how
Yeah.
I like to think of it.
I didn't know the itchy eyes was one because the half the time I
Oh
was
yeah.
sitting here, I was like, I got like an eyelash in my eye, and
Yeah, I don't know if
I'm,
that's your problem.
yeah, yeah. Hopefully not. And so, Laura, where can people find you, and what's the best way for them to reach out to you?
Yeah, so you can find me on Facebook and on Instagram at Sapphire Women's Healthcare. There's two P's in Sapphire. And then you can reach out from my website, which is sapphirewomenshealthcare.com. And if you're ready to book, you can do it right through there.
Awesome. And we'll have the links and everything posted on our website as well if you need to do that through Barbell Therapy. So, anything else you'd like to add, Laura?
Yeah, I think just if you are not getting the answer that you want and you feel like you deserve something better, there are people out there who are willing to give it to you if you just find the right person.
I completely agree to that. I mean, one of my things with the main theme of my podcast typically is like, don't take no for an answer, listen to your gut, and you need to advocate for yourself. And like, there's plenty of
Mhm.
times now too, I'm going to patient visits with them because they're just like ran over by a medical provider, and it sucks. And that's
Yep.
why
Yeah.
I do these things to try to change healthcare a little bit and give some people some better information and better options out there. So thanks for participating in this with me.
And thank you for doing that too. We appreciate it.
Yeah, no problem. All right. Well, thank you for that. And if you have any questions about Laura's services, feel free to reach out to us as well. All right. Why is this? It's not letting me hit the stop button. That's not good. Let me see. Is there anything on your end that? Mm,
Um,
you know what? I'm just gonna remove you and see what happens.
okay.
So, Laura,
All
thank
right.
you so much for this, and we'll probably chat soon. I'll let you know when the podcast and everything comes out, and we'll clip you in on it and everything too.
Awesome.
Tag you.
Great. Well, thank you. This was great.
All right, take care. Thanks.
You too.
Bye.
Bye.